Step into Office Hours with California's Doctor, where health meets real talk. Hosted by the California Surgeon General, these conversations will tackle health issues that truly impact everyday life. From mental health struggles to game-changing medical innovations in public health, we will dive deep into the topics that matter most to Californians and their community. Informative, empowering, and thought-provoking. Whether a professional advocate or simply curious about improving well-being, these conversations are a trusted source for insight and guidance. Your health is the foundation for a healthier future. Let's build it together. On this episode of Office Hours with the California Surgeon General, Dr. Diana E. Ramos sits down with Dr. Sharief Taraman to discuss the intersection of maternal and child health and innovation in health.
Hello and welcome to our audio series. Today, it is my sincere pleasure and honor to welcome Dr. Sharief Taraman. He is a dual board certified physician in neurology with special qualifications in child neurology from the American Board of Psychiatry and Neurology and clinical informatics from the American Board of Preventive Medicine. He is the Chief Executive Officer at Cognoa, the first and only FDA-authorized AI-based diagnostic device for autism for children 18 to 72 months old with concerns for developmental delay. It's been my pleasure and honor to have known and worked with Dr. Taraman for the past several years. He truly is a pioneer, an innovator, and is working to change medicine. So Dr. Taraman, welcome, and thank you so much for joining us.
Thank you, Dr. Ramos. It's a pleasure to be on your show.
Thank you. I want to start out because you are changing medicine. You are creating the future of medicine. Tell me, how did you get into AI? How did you get into innovation, creation of the next wave of diagnostics and treatments when you started out in neurology, seeing patients, one patient at a time? Now you are treating populations. Help me understand.
Yeah, no, I think I've always been a techie at heart and looked at, having been raised by engineers, how to have an engineering mindset to fix problems. But I'm also very fortunate. We have an amazing both Artificial Intelligence and Innovation Institute at now Rady's Children's Health of Orange County. And that group, which was founded by a close colleague of mine, Dr. Anthony Chang, really helped lay the foundation and the framework, and also honestly just having the time to look at how do you use information and technology, which is part of that second board certification that I have, to really address some of the most honestly pressing problems that we have in healthcare, in society. And I think as much as we have amazing physicians and clinicians and nurses and all these individuals that work in healthcare, the reality is that there's a shortage of all of them, especially specialists, especially pediatric specialists. But even more so, there's opportunities where technology can be used to really drive and improve our lives if designed and implemented correctly. And I think, we all have an opportunity as clinicians to really think about these problems and think about what are interesting ways that we could actually upscale our workforce, for example, which is what a lot of the technologies are able to do nowadays.
Technology is really one way of addressing increasing access to the care that is needed. Any thoughts on disparities in terms of providing the care for those who oftentimes don't have access to the care that they need, whether they're socioeconomic or whether it's culturally needed care? Any thoughts on how you're using technology to address those needs?
Yeah, so I think that this is interesting. There is this concept of what we call the digital divide, which is, people that have access to technology and those who don't. And again, I think that this is being thoughtful in how you approach problems. So one of the things that, we were doing when we were developing this autism device for diagnosis through the FDA was really thinking about how can it be deployed, electronically remotely. So we were actually working on Indian reservations to try and make sure that we had good representation from the indigenous population of the United States as an example, right? And if you think about, do they have Wi-Fi and 5G and all that stuff? Maybe not. And so I think these are kind of always challenges that, we can face and address. I don't think that we should try and limit ourselves, because even if there is some disparity, the question is can we figure out other structures, such as, providing, smartphones to lower socioeconomic families. And I think there are government programs where, that is a thing, and it can be very helpful. I remember, I think I told you this story, one of my first telemedicine patients during the COVID pandemic, when we started really doing telemedicine, actually joined the telemedicine visit from an alley behind a fast food restaurant where they were able to get a Wi-Fi connection. And I did a telemedical visit literally in an alleyway for this lower socioeconomic status family. And so, again, I think people are gritty and creative, and as much as we can try and support them and find mechanisms to get them access to technology, that should not hinder the use of technology, because in fact, that it actually does democratize medicine in many ways for individuals.
Well, thank you so much for being part of that breaking the digital divide gap, and your leadership is truly appreciated. Now, I know I want to go a little bit more into the area that you specialize at, and that's neurodevelopment. Can you describe the importance of nurturing neurodevelopment, and what does that mean?
Yeah, so this is honestly, in my mind, and maybe why I'm a neurologist, but I think it's probably the most important thing that we can focus on from a healthcare perspective. I mean, I think if you think about physical ailments and other things that maybe develop later in life, many times they're addressable and fixable. I think for neurodevelopment specifically, though, we don't have a lot that you can do to correct things when they go wrong. And so understanding what are the things that are what we call modifiable risk factors. So what can you do that you have control over as a mom, as a dad, as a grandparent, as an uncle, to help, or aunt, right? To help the neurodevelopment of children, because that is the foundation that's going to give them essentially the rest of their life, right? And that's, again, thinking about these disparities, right? A lot of that starts, again, in pregnancy or even before pregnancy. And so as we're thinking about this maternal health, child health, which I know you've been a huge champion of, and kudos to you and your office for really thinking about how do we look at our future. And I say this often: if we're not invested in our future and the children, then we're not invested in our future as a state, and we're not invested in our future as a country, and that will lead to our demise, and that will lead to our self-destruction, if you will. So focusing on how do you support neurodevelopment specifically, but just nurturing development in children, I think is going to be crucial and critical for us as a society.
Yeah, those are great points. And I think oftentimes we overlook the importance of not only the physical care that we can provide for neurodevelopment, the medical attention, but the nutrition, the environment, the love, the emotions, all of that goes into the neurodevelopment. And, as you mentioned, I'm a big proponent of focusing on the in utero portion of the development of a baby, because really what a mom feels, what a mom is experiencing, really impacts the development of the unborn fetus, the unborn baby. And can you share a little bit more about what nurturing neurodevelopment in pregnancy looks like? Because we know that there is a correlation, like you started to mention.
Yeah, so what we know is that, for example, physiologic distress and nutrition can have significant roles in the way that the baby's brain is being developed. So if there is elevated maternal stressors, so thinking about things like domestic violence, for example, what happens and what we see is that the baby's brain will actually have parts of it where the size is smaller than what it should be, specifically in like areas called the hippocampus, for example, that's involved in memory and retaining memory. We'll also see kind of like altered brain kind of chemicals in the fetus. We've documented that. And then thinking about like malnutrition or inflammation, we know that those lead to, worser, I guess that's not really a word, but worse birth outcomes and sort of long-term consequences, both for the child's physical and mental health. And so things like managing maternal stress, making sure that they have appropriate supports, good supportive, family or other structures in place, making sure that they have proper nutrition, both in the prenatal and postnatal period, and avoiding harmful substances like alcohol and tobacco are really key to driving good outcomes for both mom and baby.
Yeah, so you kind of touched on the adverse childhood experiences, which is another area that, my office focuses on, but specifically in the reproductive age person in the mom, because we know that if we can help improve the health of the mom, like you just described, we're going to improve the health of the baby. And oftentimes we overlook that opportunity to set a more positive lifelong trajectory for our children. But it's not always easy. And in terms of the neurodevelopment, I have no doubt it looks differently from age 0 through 5 years old and beyond. Anything that you can share, and then most importantly, what can we do as future parents, grandparents, family members to ensure that we provide the best neurodevelopment for our children?
Yeah, so these first 5 years of life, and really honestly 0 to 3, but we say 0 to 5 are really crucial. So your brain is forming an astounding number of connections. It's like 1 million new neural connections per second in a baby's brain. And what that's doing is it's creating the foundation on how you're going to walk and talk and interact and all of these things. And so what you want to really be doing as a parent is exposing your child to a rich sensory environment. There's really good evidence that suggests that our ability to manipulate our environment, so playing games and being on the playground and engaging with objects and touching them and using all of our senses are really, really important. And so if we think about putting our child in front of a tablet or an iPad or whatever, TV, whatever it may be, what happens is we have actually seen that actually alters the baby's neuronal connectivity, so the way the brain is connecting, versus if you're engaging and playing with the child and singing and talking and reading and even baby talk, as sort of silly as it may be, that extra intonation and the singing part of it actually is really foundational for learning how to talk and read later on in life. And so I think as caregivers, we really want to be able to attend to our children. We want to engage in these positive interactions, which are positive exchanges and language-rich environments. So like if I have a parent and their child has speech delay, I tell them it sounds kind of funny, but narrate your life. I'm cutting chicken and I'm, or whatever I'm doing, right? I'm preparing dinner and I'm, sauteing garlic, whatever the thing is that you're doing, actually say it out loud, because that verbalization actually lays the foundation as those brain cells are connecting, the neurons are connecting, that it allows those kids to actually have a much better development. And then if we see something where we're not really going on track with development, the earlier we intervene, the better. And so, this autism device that I helped work on to try and help detect autism early, one of the big reasons for that is that when I was division chief at the Children's Hospital, there were so many kids that needed evaluations. We weren't able to see them fast enough. And we know, for example, in autism specifically, the average age of diagnosis is like 5 years of age. If you can find these kids at 3 years of age, almost 40% of them will do so well with early interventions that by the time they hit first grade, they're in regular classrooms versus in a self-contained special education classroom. So, right, that's not only way better outcomes, but it's also huge cost savings to the state, the healthcare system, et cetera. And that those kids in that first grade classroom, when you find them at 3 and under, they actually do so well with speech and occupational and behavioral therapies that almost 40% of them will do so well that they actually, quote unquote, lose the diagnosis. And what I mean by that is that one of the criteria for autism is that the the social communication, repetitive, stereotypic behaviors that we see in autism, these things that are, sensory disturbances, they have to create daily challenges in your ability to function. And those kids do so much better that they really don't meet that criteria. So they're still neurodivergent, but they're neurodivergent in a way that they will likely go on to have good jobs and families and all the things that make oneself happy and successful in life. And a lot of those challenges are overcome.
Thank you. So you remind us of the importance of the human touch and the human interaction. And, when our kids are young and babies, like you said, just repeating and narrating your life. And that is so easy to do, and something that we oftentimes need to remind ourselves to continue doing. And I love the fact that we just need to put our cell phones down, look at our kids, play with them, sing with them, and read to them so that we can help them be better developmentally as they grow, and continue to encourage them with that human touch. Thank you so much for what you're doing in helping diagnose autism early on. Can you share a little bit of so if somebody has a little one and we think that maybe they have autism, where can we access this, the early diagnosis that you just shared? I think this is really important for our audience to know a little bit more about, and to be able to share with those around them.
Yeah, so we're working effectively to try and make sure that there's good, adequate coverage. So going back to this sort of disparity thing that we started talking about in the beginning, right? A lot of times the technology is available for people that can pay out of pocket. And really the company and myself are committed to figuring out how we can get our Medi-Cal populations covered in addition to all of the commercial insurers. And I think that's something that we're actively working on. We do have clinicians within California that are using the device, which is called Canvas DX, and it's software as a medical device. It's not a real physical thing. It's a software to help parents and clinicians make the diagnosis quicker, faster, more efficiently, potentially remotely. So, I had families driving from way out in the desert, 2 hours to come see us at the Children's Hospital to get an evaluation. This now allows us to do that telemedically, but even more so, we've been recognized as a primary care diagnostic for general pediatricians, for example, by the American Academy of Pediatrics, to actually just let your pediatrician do the evaluation. So you don't even need the specialist anymore. And I think that that's where the technology is really kind of amazing, is that a lot of this artificial intelligence, again, when used properly and used not independently of the clinician, but with the doctor, with the nurse practitioner, with the clinician, it makes that person who maybe isn't a expert in the field suddenly able to function at the level of the expert. And so I think that this is going to be a really big opportunity for us to improve healthcare, obviously in the state, but nationally and internationally as well.
Wow. Thank you so much, Dr. Taraman, for really focusing on addressing that disparities and creating the solutions for early diagnosis, and providing the opportunity for everyone, no matter where they live, to have the autism diagnosis screening. So really appreciate everything that you're doing.
Thank you.
Now, I want to start wrapping us up and just ask you two questions that I ask everyone that comes on. And that is, the first one is, what does health and well-being mean to you personally?
Honestly, probably the biggest thing for me is finding time to disconnect. So people that know me know that I will disappear for about 60 to 90 minutes. I try and do it every day, where I'm completely disconnected. You will not be able to reach me by any text, cell, whatever. And I'm actually doing usually hot yoga, but sometimes just regular yoga. And for me, that's a meditative space. And before Dr. Ramos and I were actually chatting about one of the great ideas that I got, which, by the way, happens in that quiet space for me. And so it's an opportunity for me to get that mental as well as physical well-being simultaneously in a hot room, which, by the way, activates something called heat shock proteins, which are very good for your body and longevity. So that's my sort of health du jour that I do at least 5 to 6 times a week, if not daily. And then, honestly, I'm trying to be better about what I put in my body. I think what we eat, what we consume is very, very important. And these are the building blocks and the foundations that make you who you are. And so, I'm just trying to be more cognizant of what's going inside of me, nutrition-wise, I guess.
Fantastic. I learned something. Heat shock proteins. I'm going to look that up. So longevity, I'm all for that. Thank you. And then the final question is, what's one innovative idea that you have to improve the health of California? Now, you're doing a lot already. Is there an additional one?
Honestly, I think the most important thing for us to be focused on, and I'm going to go back to the kids, is developing and mentoring the next generation of clinician, engineer, innovator, inventors. I think if you follow me on some of the socials, you'll see that I just recently had a device that I worked on with, at the time, I think he was maybe 9 years old, now 17-year-old. He's a named inventor on a device that we worked on. I help run an internship for high school and college students that I think is wildly important. I teach at several universities within the state. And I think that this investment in the next generation is so important. And so if we want to improve health in California, we need to invest in the next generation of, health entrepreneurs, health innovators, health, engineers.
Thank you, Dr. Taraman. Yes, it's paying it forward, because we are going to be the patients in the future and helping create the solutions for the generations to come, and investing in them is right on. Thank you so much for all that you do in creating the future of healthcare, reinventing what screening and patient care and access looks like. I am truly grateful for all you're doing and for taking the time out to speak to me. Have an amazing day, and let's continue together in health. I'm so appreciative of everything that you're doing.
Thank you, Dr. Ramos, and thank you everyone for listening.